Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore how healthcare professionals monitor patients for cervical cancer recurrence, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. Following treatment, regular follow-up appointments are vital to monitor a patient's health status. These appointments serve as an opportunity to discuss any symptoms or concerns, conduct a physical examination, and perform a pap test to check for signs of recurrence. Cervical cytology, or a pap smear, is a fundamental tool for monitoring cervical cancer recurrence. By examining cells from the cervix under a microscope, medical professionals can identify abnormal cells that may indicate a recurrence of cancer. Pelvic examinations are another crucial aspect of follow-up care. This examination allows the doctor to physically assess the cervix, vagina, and surrounding tissues for any abnormalities or changes that might suggest a recurrence. In addition to physical examinations and pap tests, medical imaging such as CT scans, MRI scans, or PET scans might be used. These techniques provide a detailed look at the body's internal structures, helping to identify any signs of recurring disease. Blood tests can also play a role in monitoring for recurrence. Certain tumor markers in the blood can rise if cervical cancer returns, serving as a warning sign of disease recurrence. Symptom review is an integral part of monitoring for recurrence. If a patient experiences any new symptoms, such as pain, bleeding, or changes in bladder or bowel habits, these could indicate a recurrence of the disease. Patient education is critical in this process. Patients should be taught what symptoms to look out for that could suggest a recurrence and when to report these to their doctor. It's important to note that the frequency and type of monitoring can vary depending on the stage of the original cancer, the type of treatment received, and other individual factors. While there's a risk of recurrence with cervical cancer, it's also possible for a patient to develop a new, second cancer. This possibility underscores the importance of regular monitoring, not just for cervical cancer recurrence but for other types of cancer as well. Finally, psychological support plays an essential role in monitoring for cervical cancer recurrence. Dealing with the fear of recurrence can be challenging, and psychological support can help patients manage this fear and other emotional aspects of survivorship. In summary, monitoring for cervical cancer recurrence involves a multifaceted approach that includes regular follow-up appointments, cervical cytology tests, pelvic examinations, medical imaging, blood tests, symptom review, patient education, and psychological support. The type and frequency of monitoring can depend on individual factors, and it's also important to watch for signs of a new, second cancer. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.